Good afternoon, everyone. My name is Kevin Karami, and I'm a Dean Student Ambassador for the UC Riverside School of Public Policy. It is my pleasure to welcome you all to the SPP Policy Debate hosted by the Dean's Brand Ambassadors. I will be serving as the moderator for today's debate. We are grateful you could join us today. This event is an excellent opportunity for our public policy students to apply the skills they've learned to the real world. The topic of today's debate is, should the federal government make COVID-19 vaccinations mandatory? Debating on the pro side are public policy students Arleth, Flores, Aparicio, and Rooks, and on the con are public policy students Zara and Zeno Marganian. We are also delighted to have with us today two guest judges. First, we have Ms. Saruwatari, the Director of Public Health for Riverside County, and next is Dr. Carpiano, Professor of Public Policy and Sociology at UC Riverside. Thank you both for joining us today. Before we begin, I would like to briefly go over the format of the debate. The debate will be 1 hour long, and it will start with the pro side presenting their case, which will then be followed by the con asking them questions. From here, the con will present and the pro will ask questions. After the first part, both sides will give rebuttal speeches, followed up by a final segment for questions and finally concluding remarks. After the debate, there will be an audience Q&A for 10 to 15 minutes, and finally, our guest judges will give their final statements in the last 15 to 20 minutes of today's event. Audience members, if you have any questions you would like to pose during the Q&A session, please do not send them via chat, but instead, please use the Q&A feature below. You can submit your questions anytime throughout the event via the Q&A feature. You don't have to wait until the audience Q&A segment to do that. So with that said, I'm going to hand it over to our debaters. The pro side will be going first into today's debate. Arleth and Brendan, the floor is now yours.
Hello, everyone. My name is Arleth Flores Aparicio, and this is my partner here is Brendan Rooks, and we are on the pro side and debating that why the federal government should make COVID-19 vaccinations mandatory. So the two key points that we're going to be making here on the pro side is first, herd immunity, and second, vaccine mandates as a social justice issue. So the first question, why herd immunity? But before that, I want to address what herd immunity is. So herd immunity happens when a large part of the population, the herd, is immune to the virus. Immunity will decrease transmission levels and overall the possibility of people dying from COVID-19. The federal mandate will allow us to potentially reach herd immunity. However, if we do not stop the transmission, then the virus will gain resistance and mutate to a point where the vaccinations will not be effective. Now, more than ever, it is important to stop the spread of COVID-19. So looking at herd immunity from a global perspective and then going into our nation specifically. So variant and mutation. So again, the longer the virus goes unchecked, the stronger the virus will get and mutate and build strengths. So where are the variants happening now? New variants are happening in the United Kingdom. There's a new variant called SARS-CoV-2 in South Africa and in Brazil. And as you can look from this graphic, it's spreading quickly. And so how will the federal mandate help within a global perspective? You know, it's going to decrease the probability of people specifically dying that are going to be coming into our nation. But also having the federal mandate within our own people will increase, you know, people not having to die per se, I know it's a very sensitive topic, so that's why I want to be very careful with my words. But going into that, decreasing the probabilities, the biggest thing that we want. But unfortunately, the leaders in the United States were kind of negligent in the beginning in controlling the virus. So this led to the free rider problem. So what I want to look at specifically President Trump and the Republican Party at the start of the pandemic. So the GOP kind of created a politicization of the virus of having less restrictions / guidelines, leading to an increase in anti-maskers, an increase in divisiveness between people that within our country. So what I want to state is COVID-19 cannot be a state-by-state issue because of the leaderships that may advocate for less regulations. This ideology stems from American individualism, of people being left to their own pursuits and private satisfaction. However, unfortunately, this creates a great problem when looking at a public health issue. So looking at this pie chart, why Americans aren't wearing masks in public places, Americans, unfortunately, they don't want to wear masks because it's their right and they don't have to. But this is going to create a really big problem when looking at state versus federal regulations. If states are being less regulated, the transmission between people going into from one state to another, it's going to increase the transmission levels. Hence, we need a federal mandate for it to be cohesive throughout the nation. Next slide. So because of this politicization, the attitudes and behaviors of people have created, a problem. And so looking at this graph right here, why are people worried about COVID? Between Republicans and Democrats, social distancing, even, visiting the workplace, which we're going to talk about a little bit after. So the direct politicization of the Trump rhetoric and how it impacted people's perspective of the virus, creates divisiveness, and it's going to create conflict within our day-to-day activities. And the change in attitudes and perspective over time we're not going to be able to reach herd immunity, which is going to create a bigger problem with this. Going to be excited for my next slide, looking at the economic crisis. So let's say we do have a federal mandate. Because of COVID-19, unfortunately, the real gross domestic product decreased at an annual rate of 32.9% in the second quarter of 2020, according to the Bureau of Economic Analysis. The best possible outcome for us to reach is to have the U.S. can be vaccinated 3 million people per day. But unfortunately, looking at the numbers now, we only have about 131 million people vaccinated, so about looking at 36%. So giving these three scenarios, if we are on the upside, our GDP for the US going into 2009 to 2001 can grow up to 5 to 6%, meaning that we're going to be able to have more jobs, and going into the next, we're going to have more jobs, and we just want our GDP to go up for economic reasons, which is going to actually go into transition to Brendan's, our second key point of vaccines mandate as a social justice issue.
Yeah, so we're going to go ahead and talk about vaccine mandate as a social justice issue. So first of all, we see that there's significant racial disparities in the communities that COVID-19 has impacted the most. We see that when it's age adjusted, we see that our Black and Hispanic communities have been the hardest hit comparatively to our white population. This is a serious issue because we want to make sure that these racial disparities aren't exacerbating any other gaps that are already existing, because we just want to make sure that everyone can kind of achieve the point where we can reach a level playing field. And so when we look at this as well, we also look at the title of essential workers. So we want to look at, okay, well, who are the essential workers? How much money are they making? Where are they working? We see that the lowest earning essential workers are the ones that are being forced to work in person and are the ones that are the most exposed to COVID in the first place. This is a really serious issue because, if they're not being taken care of and if there's no safety that's ensuring that they won't get sick, then they can be exposed, and we can have our most vulnerable communities being the most susceptible to the virus, which is something that we've kind of seen a pattern of up to this point. And kind of on that note, we also see that over time, and this graph is representing cumulative daily COVID-19 related workplace safety complaints. So that's kind of regarding, okay, well, if a worker doesn't have personal protective equipment, or if there are any other issues that workers are facing, then they can file these complaints to be, that their safety isn't being provided and that they're kind of in a situation where they could potentially be exposed to the virus, get sick, and potentially die. And we just want to make sure that this isn't happening. We want to make sure that workers' rights are strongly enough to the point by which all of our workers that are working in person have the opportunity to be protected fairly. As those people that are allowed to work from home, because the people that are working from home don't even have to deal with these situations in the first place. Kind of on that note, how do we reach the point wherein our workers have enough rights to be able to fully, bargain for their safety? So we see this through collective action and collective bargaining through different union memberships. And unfortunately, since the early 1970s, we've seen that in the past 50 years that unionization has decreased from 25% roughly to a little bit above 10% today. This is a serious issue because workers that are being exploited and aren't being provided for, whether that be personal protective equipment or whatever, they don't have the power against their employers to really advocate for themselves or to, have that collective bargaining, which is a serious issue. And, we see that here as well. So this map on the left is demonstrating a map of the United States and kind of looking at, okay, what are the different union laws of these states? We see that the darker green states are states that have strong and very comprehensive worker right legislation that kind of allows them the right to unionize and to, engage in collective bargaining. Whereas the gray states have either weak laws with limited rights or no laws, or laws that ban collective bargaining from public workers. And we see a direct overlap of these two maps. So the map on the right is actually demonstrating minimum wage in the United States. So, we see, okay, the states that have the least amount of workers' rights or workers' protections are the states that also have the lowest minimum wage. So the states in gray have the lowest minimum wage, and the states in dark blue are the ones that have the highest minimum wage, or with Washington, D.C. having a $15 minimum wage being the highest, and California at 14. And then for reference, right now, the minimum wage federally is, I believe, $7.25. So that's a very significant difference. And, these are the people that are kind of typically being exposed the most. So our essential workers are kind of the ones that are also typically having the lowest wages, as was indicated by the previous graph. And then another representation that we can see here is a lot of these states that have weak union protections and the lowest minimum wages are also the states that tend to be governed by Republican governors or by Republican leadership. So kind of talking back on Arleth's point, we see that because of the politicization of the virus, we see that the Republicans aren't necessarily promoting the guidelines or the public health practices that need to be in place to fully protect our people. And we see this by this next graph. So this next graph is demonstrating a link between state leadership and deaths per capita from the different states. So the red dotted line all through here is indicating so it's by month over here. So it's deaths per million per capita per state. And we're kind of seeing then that, ever since roughly July, that Republican states have had a significantly increased death rate for COVID. And we're kind of tying this back to the point that due to the politicization of the virus, that they aren't taking the appropriate steps to protect their citizens due to Trump's rhetoric and the kind of Trump takeover of the GOP. So as a result, this is kind of our moral imperative for the federal government to mandate the COVID vaccine so that we can make sure our most exploited and our most vulnerable workers are being fairly protected under the law. Thank you.
Thank you, Arleth and Brendan, for your presentation. So we'll now transition into the questioning period. Zeno and Zara, you may begin.
Hi, thank you so much, Kevin. And Brandon and Arleth, we just have a few questions for you. Our first question is, as the concept of it being a federal policy, can you please provide some more information regarding how much a policy, or at least how much it would cost, estimate about for the federal government to make these vaccines mandatory? Is there any form of information you have to provide more details on that concept of the policy itself?
So if I'm understanding the question correctly, you're asking how much it costs to mandate the vaccine federally. To my understanding, to go ahead and just pass that legislation to mandate the vaccine actually costs $0 because it's really just our senators that would be going ahead and mandating it. Currently, under the current system by which we're distributing vaccines, it's already being done by the state. So, I mean, it doesn't really matter if it's, oh, hey, we're going to go ahead and take, like this, the state is already doing it. The federal government is already the entity by which the vaccines are being distributed to the citizens. There's no insurance, you don't need any copays for the vaccine, which is great because unfortunately, if we wanted to pass off this responsibility to a private institution or to the private sector, they would be charging for these vaccines. We see it already with the global health situation. We see that the most developing states are the states that aren't getting access to the vaccines simply because our pharmaceutical companies are wanting to hoard profits and not give them away for humanitarian efforts to these developing states. So, I think all those answers kind of point to exactly why the federal government needs to mandate.
Okay, and then just a quick follow-up question. In regards to federal policy, it is extremely important, and there's a handful of factors that are extremely important, especially in regards to how willing and able states, counties, and cities are able to adapt to these mandates. So could you provide more information of whether, and I'm sure you naturally answered this, but can you provide details of whether this mandate would be an unfunded mandate or a funded mandate? Because that makes an extraordinary difference in regards to the states, counties, and cities.
So if I'm, can you go ahead and just elaborate on like what exactly you're asking?
Yes, so when a federal mandate is created, there is an unfunded mandate and a funded mandate. A funded mandate comes with funding attached to it, as the name implies. And unfunded mandates require that states or the area that they are being enacted in find the funds to fill the budget or fill the mandate itself, which often forces cities, counties, and states to reallocate funds from when they are previously being used. So is this an unfunded or a funded mandate?
Strictly speaking, I don't necessarily, because I think from this question, from my understanding, this is from a framework of scarcity instead of a framework of abundance. I think that our states and our federal government, if they want to, either one would be able to find the resources. I don't think, given the current budget situations, that we're not scarce. We have a lot of money. We're the richest, most affluent nation in the world. Like, we should be able to afford these basic things for our citizens. And strictly speaking, I don't think it necessarily is a massive issue. I don't have enough information to tell you my opinion personally on whether it should be funded or unfunded. However, I know that both entities would be able to cover the costs, and that if the federal government would so desire to, for states or for counties that had smaller budgets, I'm sure that they could figure a way to subsidize those states to try to help them. We already have federal subsidization of our poorer states from our richer states. So, a similar kind of framework could be adopted where those states that are more affluent and can afford it can do it. And, it's just the general welfare state within our federalist state, so that the rich states could also help the poorer states in their funding.
Perfect, thank you.
Thank you again, Brandon and Arleth, for that presentation. Another question that we have regarding it is, how does the federal mandate or the federal policy plan to address the different racial, social, and economic issues that different communities face in different states and counties?
Okay, looking, so we do have 30 seconds. But in regard to racial and economic issues, I believe the federal mandate will help. When looking at the graphs that Brendan was showing in the slides before, even looking at the minimum wage, even looking at unionization, the mandate will actually help people, especially when trying to get back the economic, having people getting back, to business. Kevin, do I have enough time?
Unfortunately, that is all the time we have. You can't, totally free to put a footnote on that. You can answer that question later on if you like.
Okay, I was just gonna say, the more vaccines that we do have and getting back everyone in person will increase people having jobs and money, and hopefully their income when it comes to the racial disparities, and the systematic stuff in America.
So thank you for the questions, Khan, and thank you for answering, Pro. So from here, the Khan has 10 minutes to present their case.
Hello, everyone. I'm Zara Ali.
And I'm Zeno Marganian, and we're here to explain why the federal government should not make the COVID-19 vaccine mandatory.
We believe that the government should not make the COVID-19 vaccine mandatory due to the aspects of feasibility, costliness, discrimination practices, and because of the potential alternative policy solutions available.
We would first like to state the vaccinations currently available to the public are safe, they are reliable, and this is supported through the information that we will display on the next two slides. It is also important that the majority of the United States population receive the vaccine in order to help the US reach a state of herd immunity and normality.
The graph displayed shows the number of doses currently offered by the Pfizer, Moderna, and Johnson & Johnson vaccines, totaling to over 129 million fully vaccinated people, equivalent to over 39% of the US population.
And this graphic being displayed shows the effectiveness of multiple COVID-19 vaccines, with the Pfizer vaccine having an overall effectiveness of 95%, Moderna with a 94.1%, and AstraZeneca with an overall 70% against the novel coronavirus. We pose no challenge to these concepts, but believe that the federal government making these vaccines mandatory in this instance would not be the best option for the US to reach herd immunity. Is the federal government making the COVID-19 vaccine mandatory even feasible? One of the reasons why the federal government should not mandate the COVID-19 vaccine is because of the lack of feasibility that the plan has.
Regarding the current state of rapid vaccinations and the substantial portion of the population that has been vaccinated, the states are already making great progress. With 20 states having vaccination rates at 50% of their populations receiving at least one dose of the vaccine, the progress of distributing and administering these vaccines has been terrific. States previously been awarded the ability to make vaccines mandatory and even the ability to specify aspects of the mandate, such as what age group gets vaccinated first and the religious and philosophical exemptions to the vaccine. Although the federal government may have the ability to pass a policy requiring vaccinations, it is a legal gray area. There is still the possibility that the federal government making these vaccines mandatory can be struck down as unconstitutional by the Supreme Court, as the federal government is able to act within its specific enumerated powers. However, it is not only the current standard that states have the legal authority and precedent to make vaccines mandatory. This power is confirmed in the 10th Amendment power to the states and court cases Jacobson versus Massachusetts and Zuck versus King. With the strides of progress we've already made towards vaccinating the population and already allowed authority to the states to address vaccination mandates, is federal intervention even necessary in this case? It's no secret that federal policies are expensive.
For any type of policy or resolution that is passed at the federal level, there are many important aspects. One of these aspects is whether or not the policy or mandate is funded or unfunded. This distinction is extremely important because it determines whether or not states will be forced to reallocate funds within their already tight budgets. There have also been instances where cities and counties have rejected federal mandates due to the fact that the mandate was unfunded. This cat and mouse game of whether federal mandates are funded or unfunded and the willingness of states and the ability for them to meet the demands of the mandates makes a federal approach not the most viable or feasible option to address the topic of making COVID vaccines mandatory. And from an economic standpoint, it is important to at least consider what else could have been achieved if the resources and energy put into a particular option was relocated elsewhere. This is the concept of opportunity cost, which is the lost potential gain from other alternatives when one alternative is selected. For instance, if the funding and other resources required to pass and fulfill the federal government making these COVID-19 vaccinations mandatory were put towards other policy solutions, it is important to at least see what else could have been accomplished. And as you can see on the slide, we have two plans, one from the Department of Housing and Urban Development and one from the CEO of Hunger Free America, and their associated costs to, one, eliminate homelessness in the United States, and two, to eliminate hunger in the United States. And now, despite the fact that there wasn't a specific number given to us of the cost of this plan, I'm sure that these $20 and $25 billion plans would fit into that budget.
In rebuttal of the federal policy mandate proposal, there are multiple other policy options that could work better than a federal policy solution to help reach herd immunity. The US is rapidly vaccinating the people and reaching towards herd immunity in speeds that were previously unimaginable when the COVID-19 virus initially appeared in the States. So globalizing the vaccine administration and sending vaccines to multiple third world countries would help save millions of lives and slow the speed of COVID-19. Currently, under the Biden administration, 20 million doses of Pfizer, Moderna, and Johnson & Johnson, as well as 60 million doses of the AstraZeneca vaccine have also been sent out to other countries that are in dire need of the vaccine. The US has also taken a step further in giving $4 billion to vaccine development in India to help them fight this current humanitarian crisis against COVID. Currently, as the United States is in a hurry to vaccinate the country as quickly as possible, the states have been taking on the responsibility of rolling out vaccines in a proficient and timely manner. Does going back to normal mean just the US or the entire world together? Normalcy means the entire world has to recover, not just the United States. If the United States does not expand and help other countries, then we can never truly reach a state of normalcy. States can expedite populations that are high risk to receive priority vaccination so they can stay safe and not contract the high risk disease. The states have the power to do so as they are rolling out vaccines in their states to mandate the vaccination, something that the federal government lacks in their power. And these state vaccination rollout plans have been incredibly successful, as for example, in the state of Vermont, around 89 out of every 100 people have been fully vaccinated, and moving the state to becoming one of the highest states with fully vaccinated citizens.
And this graphic, non-medical state exemptions for school immunization requirements, depicts a clear image of how states have already implemented a religious and personal beliefs exemption of vaccines for students to attend school. The important part of this image is to notice that different states have different perceptions of what they believe would work best, whether that is allowing religious exemptions or personal exemptions, or allowing no exemptions to the vaccine at all. This image helps depict why a one-size-fit-all federal policy would not work for the many different states that have differing opinions and different ideas of what would be the most beneficial and successful for their individual state. An additional aspect that needs to be taken into account when looking at the COVID-19 vaccination rates is the racial disparities that are evident in current vaccination progress taking place across the US.
The information presented on this slide comes from the Center of Disease Control and shows the current massive disparities between race and vaccination status, with 62% of the current vaccinated population being white and the next closest ethnic group, Hispanics, being 13% of the vaccinated population. It is evident that there are disparities between race and the status. Despite federal policy potentially being able to merge these gaps, no one knows the specific needs and what would work best other than their states. The states would be able to more accurately address these disparities due to states knowing the amount of people within the population, racial and ethnic breakdown of their population, the current status of vaccination their citizens have. These are just few of the many factors that would make states more equipped to accurately address the issue of minority discrepancies regarding the COVID-19 vaccine.
As previously mentioned, there are alternative options to a federal mandate, such as letting states mandate the vaccine instead. In line with the current procedure, protocol, and statute, states have the full authority and right to mandate vaccines. This power is established by 2 Supreme Court cases and the 10th Amendment. The case of Jacobson versus Massachusetts in 1905 upheld the authority of states to enforce compulsory vaccination laws, and the case of Zucht v. King in 1922 enabled schools to enact an ordinance prohibiting any child from attending a public school without having first presented a certificate of proof for the vaccination. These cases also help to establish the state's authority of police power, which is the capacity of the states to regulate the behavior and enforce order within their territory for the betterment of the health, safety, morals, and general welfare of their inhabitants. It is through these examples that states have had the long-standing precedent and authority to handle the process of making vaccines mandatory. And not only have states tackled this responsibility and duty of mandating vaccines, they have done a tremendous job at fulfilling this responsibility. With the standards set and with the states already doing a great job at being able to legally have the authority to mandate their vaccines, and also with them being able to reach great overall median vaccination rates, then why differ from a model that is already established and already works? And as you can see from the bottom of this slide, some information from the Centers of Disease Control with median vaccination coverage. And these are all state required vaccines. And as you can see, We have great percentage of median vaccination coverage, well enough to achieve herd immunity, and this is solely through the actions of states taking their steps to mandate vaccines.
We believe that the federal government should not make the COVID-19 vaccines mandatory due to the aspects of feasibility, costliness, discrimination practice, and their potential alternative policy solutions that were presented. Thank you.
Thank you, Zeno and Zara, for your presentation. So at this point, Brendan and Arleth, you can begin asking your questions.
Cool, thank you. So kind of my first question to y'all in regards to your state-by-state plan. You know, in our presentation, we talked about how the COVID-19 pandemic has been politicized, and as a result, that these states haven't implemented the proper guidelines to kind of adhere to proper public health practices. So are you denying that COVID has been politicized over the past year and a half by the GOP?
Okay, so we are in no way, shape, or form denying that COVID has been politicized. We are just simply illuminating the possibility that a federal mandate would actually politicize and polarize our nation even more than if states were able to make their own distinctions. As evident in one of the pictures we showed, states currently have the ability to determine what the residents of their state wish, whether that be having exemptions for vaccinations based on religious or philosophical beliefs. And so this kind of shows that states know what states want. And also it's important for the people within a state to be able to kind of determine the course of action that their state takes. So there is obviously a polarization of this, not only the vaccine, but the virus as a whole. But we believe that a state-by-state plan would actually assist in that way by letting states determine the exact protocols they follow in their steps forward for what their perceptions are, what would be best for their state. So instead of the possibility of polarizing a portion of our nation by a federal mandate, and in this case, an unfunded federal mandate that would force states to reallocate funds, we allow states the ability to make their own determinants of what would work best for their specific populations, their specific percentage of their population that's already vaccinated. And as you mentioned in your own speech, the importance of GDP and states reopening, even giving the states the ability to determine at which rate they reopen in order to help rebuild the GDP that we have seen go missing over the past year.
Thank you, I appreciate that. And then just kind of another question. So you speak about the funded versus unfunded debate and how, you know, you highlighted a few different programs that could be funded with the funds that would otherwise be used. So, because my understanding is that this is kind of being addressed from a scarcity perspective. And, you know, we have this fiscal year, we have a $778 billion military budget. And so I don't understand why we can't reallocate some of these sources from these, you know, our military budget is 10 times greater than any other state, or 10 times bigger than the next 10 states combined. So how come, you know, we're addressing this from a scarcity perspective instead of an abundance perspective when we clearly have the resources?
Yeah, we have, we are not in the position of whether or not to state where we believe funding should come from. We were just asking if there was any specific or particular plan in order to address these things. Whether or not if it was a funded mandate, then it would be the job of the federal government to determine whether or not they pull funding from, let's say, a military budget or a different one of the budgets that we have a surplus of money in. But if it's an unfunded mandate, then that same question gets asked to the states. And now you have states making the distinction between whether or not they have programs to, in this case, help reduce homelessness and hunger, or whether or not they have to try to fill the shoes and be able to jump to the bar that the federal government sets. So we are not in the position to talk about whether or not the military's budget is too large and how that could do a lot of good elsewhere, in the same way that it is important for, if it is a funded mandate, then that would be the job of the federal government to make those types of distinctions. But the fact that it would be an unfunded mandate would mean that states now have to reallocate funds or find ways to fill the shoes that the federal government gives to them.
I have thank you for your statements. I have a question in regard to the economic standpoint that you were pointing out of the cost of plan or your plans for either ending, transitioning the money to homelessness or to end hunger. But I could see how you'd want to do this in the sense of giving back money to the people that need it. You know, this has been done through the CARES Act or the other federal act as well. But when the question that I do have is, how are we gonna, aren't the states the reason though that these disparities exist currently?
Well, so there's many explanations for why there's so many disparities from state to state. And this falls into the category of why a federal mandate and the one size fit all policy is not a significant option or alternative to address this. It is evident that different states, different counties, different cities all vary, whether that be by their population, by currently their vaccination status, whether that be by their ethnic and majority breakdown. These states differ very much so. So although they are different, that is the reason why a federal policy is not sufficient.
That's all we have for questions. Thank you, everyone. From here, we're going on to the pros rebuttal speech. This will be 7 minutes long. Arleth and Brendan, floor is yours.
Okay, fantastic. Thank you. So in terms of our rebuttal, so our other debaters here have addressed this as a funding versus unfunded mandate situation. And, you know, if the government were to, this is all hypothetical as well, I would like to point out that if the government were to pursue a unfunded mandate, that the states and the counties would be responsible for reallocating their budget. You know, I think this is addressing it from a point that could happen, it could not happen. It's our whole point of our debate is, should the federal government mandate the COVID-19 vaccine? It's not how they do it, it's not the way that they do it, it's just should they. We've addressed throughout our point that, you know, with the current politicization of the virus and the fact that the Republican-led states have the loosest COVID guidelines that they have, you know, they also have the highest death rates per capita of from COVID. So, you know, we see this issue that there is this distinct polarization wherein Republican-led states simply are not protecting their citizens. So this is just an issue that needs to be addressed. And as well, you know, our fellow debaters kind of talked about from the perspective of a global versus domestic issue as well in terms of our COVID vaccines. You know, I think that obviously we as a country and we as a world need to protect ourselves from the COVID-19 pandemic. However, we can't do that domestically unless we do mandate it. You know, we can mandate the vaccine and still provide vaccines to other countries. You know, this is something that we can do. I mean, the biggest thing that we can do is we can go to the World Trade Organization and we can fully sign on to the fact that we can waive the patent rights for the vaccine. That is currently the biggest issue facing the developing world in accessing these vaccines. What we need to do as a country is we need to advocate for developing nations and not practice neocolonial practices against them by hoarding and making sure that we're allowing for our pharmaceuticals to become pharmaceutical companies to profiteer off of the pain and anguish of developing countries. If we were to waive this patent right, then these developing countries would be able to develop their own vaccines and we would be able to keep the vaccines we have right now and focus on our domestic population. We need to do that so that we can make sure that the COVID-19 vaccine, the pandemic, doesn't continue to produce new variants, so it doesn't mutate. As well, you know, our opponents kind of talked about how these different states, if we were to mandate and do the unfunded, then they have the full discretion to decide how they implement this mandate. They talked about, you know, providing different exemptions. And I would like to point out that in 2014, I believe 2014 to 2015, there was the measles outbreak that was caused by too many exemptions. And so, you know, there's this issue where we want to make sure that, you know, it's mandated so that everyone has to get it. You know, we're not going to say want to make sure that everyone's getting it so that this doesn't mutate to a point, because right now our biggest concern is that globally and domestically that this pandemic will mutate to a point wherein our vaccines that we're currently, or hopefully most of us are kind of have in us, aren't effective anymore. We don't want it to mutate past that point. So now I'm going to go ahead and pass it off to Arleth.
So I want to specifically talk about the con side's racial disparities kind of point of view when it comes to, reallocating the money. I just want to say that COVID-19 has exacerbated the racial disparities that have already been here in the United States. And so I can understand the relook allocation, but we have to address COVID-19 as a whole. So if COVID-19 already exacerbated what is going on in America, we need to obviously address the systemic racism, all of that stuff that COVID-19 has shown, but we need to get back to a point where we can come together, physically come together and make those policies to regulate. And so what I want to specifically say is, so COVID-19 has exacerbated it. So how will this mandate help? Again, going on from an economic standpoint, if we mandate COVID-19, if we mandate the vaccinations, the GDP will go up by 5 to 6% if we reach herd immunity. However, and this will hopefully happen with the mandate. But however, if we go from a state to state, the transmission is gonna still happen. I understand con side, that is your argument, but we have to understand transportation, traveling, looking at airlines, stuff that's happening right now when it comes to transportation is just gonna increase if we do not reach herd immunity and people are not vaccinated. So again, looking at a scenario, if the GDP goes up, it will hopefully, help the economic situation happening in America. But when it comes to racial disparities, peoples will be able to go back to work in person. And depending if they're essential workers, I know there's also that idea that Brendan that's stated in our sides is we need vaccinations for essential workers in order for them to get back to raise their income. However, or to get back into their income. So the overall situation of racial disparities from the con side is, that has already existed in America. What we're trying to address here is that we need to mandate the vaccines in order for people, to get back to their jobs in a safe way. And, and to decrease the transmissions from state to state and decrease the amount of people that are going to be dying from this virus.
Thank you, Arleth and Brendan. At this point, the Zeno and Zara, your rebuttal speech can begin now.
Okay, so to get right into it, for instance, for the proposition side to claim that the federal government should make these vaccines mandatory, it is also reasonable to say that they should have an estimate of how much this would cost. And this breaks down into the point that they seem to have an issue with of whether the mandate is funded or unfunded, because this has significant impacts on how mandates and how federal policy actually gets implemented. You can create a perfect policy, but when you don't give states the money to actually do the things you are asking them to do, it is unrealistic. On top of that, there's certain details that is needed for a plan in order for someone to be able to claim that the federal government should be able to, whether that be the actual aspects of implementation, whether that be something as simple as whether it is a funded or unfunded mandate. These simple details are extremely important because they completely shift the impact of this policy. Moving on, the proposition side has mentioned that there was an additional popping up of the measles outbreak in what they said, I believe, was 2004. Well, for instance, we have a 94.3% median vaccination coverage rate for measles, mumps, and the rubella vaccine, and that is state enforced. And so if 94% isn't enough to reach a point where it doesn't stop popping up again, how would a federal mandate, a one-size-fit-all policy, be able to accurately address the varying and in states and counties and cities. It is extremely important that we don't just set a bar this high and expect states to be able to jump the difference. It is very important that we allow states the ability to do what's right in their perception. The proposition team has mentioned many times about the percentage of GDP that would increase when we reach herd immunity. What about the percentage of GDP increase when states are able to open up to a point and able to get their economies back on track? There are many aspects to gross domestic product that falls in on how states are actually doing in producing these things. And then also to combat their point that there's a portion of people that don't get vaccinated. The reason that there was an outbreak of the measles vaccine is because there's a significant portion of people, and these exemptions are an issue. And not necessarily the amount of the very small percentage of the population that isn't vaccinated for measles, mumps, and rubella, a half of that portion, which is around 6% in total, so around 3% of that portion is people that medically cannot take that vaccine due to their medical history, whether that be they are allergic to a component of the vaccine, they have XYZ disease that puts them at risk from receiving this vaccine. So the percentage of people that aren't getting these vaccines that are state mandated and can get them is even smaller than anticipated. And so through these things, if the argument of whether or not measles has been outbroken again, in my opinion, that would have me then raise the question of what is the exact percentage to reach herd immunity? If we can't reach herd immunity with 94.6% vaccination rate for measles, mumps, and rubella, how do we expect to do it with a federal mandate that expects all states to be able to fit into the same size box when we are all aware that these states are enormously different in many factors? And continuing on, the proposition team mentioned it's important to advocate for other nations. And we aren't saying that, I'm going to pass it on to Zara.
Thank you, Zeno. Bringing up the idea of globalizing the vaccine and not making sure that the nation of the United States is protected itself is that the USA's borders don't just end where the country ends. There's always immigrants, there's always people coming into the States that also need this vaccine or coming to the US for necessary reasons. So the US is a very global player and it's a very global entity. So discontinuing like the idea of globalizing the vaccine and just ensuring that the US is protected first is irrelevant and to the idea of the federal mandate, because the federal mandate is ensuring that the US should protect itself, but still protect other people and protect the countries that it's helping. Going into the Patriot Act, going into federal mandates that were passed through Congress and have been funded that and eventually ruined the initial policy act or the policy ideas. That an example is the Patriot Act. The Patriot Act was created after the tragedy that took place on 9/11. That was created to help the American people and save the US from any sort of domestic terrorism. And this federal mandate went from something that was positive and truly helping people to something that created human rights violations or ended up being redacted being fought against by a lot of advocacy groups because of the needs and the human rights violations that it was creating. The Patriot Act violated the First and Fourth Amendment by revoking citizens' rights to privacy and freedom of speech, because the Patriot Act involved law enforcement and terrorism rights for law enforcement and terrorism in the need of the Patriot Act violated the First and Fourth Amendment in its policy solution, and the fact of the matter is that federal policies and mandates, even though they are created to help people and protect citizens' rights, they have hurt citizens in many ways and put their rights at risk multiple times, and especially in federal mandates.
Thank you, Zeno and Zara, for your rebuttal speech. So at this point, we'll be transitioning into an open question segment, and here both sides will be taking turns asking the questions. So naturally, the pro would ask the first question. So time starts when you ask the first question.
Yeah, so I'm a little bit confused by the point that was being made about the Patriot Act. I'm kind of confused within the context of what this is being brought up and how it's applicable in this situation.
I apologize, that was my fault. I didn't make the point as clear as it possibly could have been. The Patriot Act was a federal mandate that touched every corner of the US. It affected every state government, local government, and government entities that the federal government falls under. So the Patriot Act, because going from a policy solution that should have helped the United States and protect them from domestic terrorism or international terrorism, slowly became a human rights violation as the federal mandate went from creating this sense of security to the US. Instead, it gave power to the law enforcement and FBI, CIA to intrude into people's personal information and personal conversations and take any information that they saw warranted without a warrant as granted in the Fourth Amendment of not being able to privacy laws are seen in the Fourth Amendment and its states' rights. The Patriot Act, the point being brought up by Patriot Act is that the Patriot Act is indeed a federal policy that's an expansive policy that instead of helping the people it was meant to, instead of helping the US citizens and its entity, it went from there to hurting citizens.
So would you say that all federal mandates are bad in a sense then?
No, not all federal mandates are bad. It's just important to shed light on one like the Patriot Act, which was so expansive that it was not able to do effectively what it was initially set out to do, and it ended up creating issues. And we're not saying that the vaccine shouldn't be mandated. We're just saying that the federal mandate is a bit too expansive and isn't going to work as well as initially thought out on paper. Just because the great policy is pushed through the Congress doesn't mean that the actual implementation aspects will be as effective.
So at this point, the Khan can ask the next question.
Okay, sorry about that. So just a very quick question. With the current standard that states have the authority to mandate vaccines upheld by the Supreme Court in Jacobson versus Massachusetts and Zucht versus King, can you please elaborate further on how or why a federal mandate would be better than the current set standard?
Yeah, so I mean, I think we've talked on this a lot. I think, given the fact that the COVID-19 pandemic has been politicized to the point that it has, wherein there's clear patterns of Republican-led states having increasing deaths per capita due to COVID. It's a direct result of their lack of guidelines and their complete neglect for human life. They refuse to put this in a perspective of public health. They're putting this in a perspective of, we need to reopen the economy. We need to reopen the economy for who? Your states are the states that have $7.25 minimum wage. Your states are the ones that are not protecting your workers. So you're clearly advocating, then at least these Republican governors are advocating for the fact that these economies need to reopen for the capitalist elites, the ones that are exploiting and profiteering off of a pandemic. So in terms of why we need a federal mandate, we need it simply because the Republicans, if it was left to a state-by-state issue, the Republican leaders of states simply would not mandate it. I don't really know how else you kind of want me to state that. There's been clear evidence that we've presented that states that this has become a extremely polarizing issue that one side doesn't want to take any responsibility for.
And if I can follow up to Brendan's answer as well, we need to set the bar high. If we don't set the bar high, then how do you, setting the bar high at the federal level will get a cohesive and, argumentative, like let me rephrase that. We need to set the bar high. If not, it's never going to be set high at all. And that starts with the federal mandate, because it needs to be, it needs to be throughout the whole nation. If not, people are just going to have the state to state transmission. So.
Thank you everyone for your questions. So at this point, we'll be transitioning into the concluding remarks. Each team will have a brief 2-minute period to just give a reason as to why they believe their side won the debate. So Arleth and Brendan, your 2 minutes starts now.
So we kind of believe that the pro side has made the better argument due to the fact that we've highlighted the fact that the COVID-19 vaccine, or the vaccine issue, has been incredibly politicized to the point wherein Republican state governments are not taking any responsibility for ensuring public health guidelines are being practiced to ensure the safety of their citizens. As well, we talked about the opposition might even mentioned that given the current state mandates that, this measles outbreak was still allowed to happen, and that was a direct result of a state mandate. And, I'm not going to say whether or not that's an issue of the state mandate wasn't high enough, but it's clear that, given the politicization that there's no other real solution. And I'll go ahead and give it to Arleth to give her closing thoughts.
I think overall, we need to have a federal mandate when even looking at, the variant and mutations. We have vaccinations rolling out state by state, which is very true. Most states are doing that. But if people are not getting vaccinated, or even have, the immunity, or, if they don't even have the immunity themselves, then they might be carriers, the mutation is going to be happening. We see it globally with new variants coming out. And so this is going to be very detrimental when coming into the new year, or within, the next couple of years, to be seeing, hey, maybe another wave is going to come and we're going to have to close the economy again. So mandated vaccinations federally will allow our country to be able to, reevaluate ourselves and state, hey, this is not okay. We need transmission to decrease. We need the GDP to go up. And overall, stop this virus. And I believe that's going to be happening through a federal mandate.
Thank you to the both of you for that. And finally, the con can give their concluding remarks.
With the idea of a federal mandate, there's no guarantee that states will agree to a federal mandate and even enact them in their states. The best thing that the federal government can do in this case is pass legislation for an easier access of states being able to get vaccines, and removing patents so states don't have to pay for vaccines in any way, shape, or form, and are able to distribute vaccines faster than ever.
So to quickly reiterate, we believe that the federal government should not make the COVID-19 vaccine mandatory due to the aspects of feasibility, costliness, discriminatory practices, and because of the potential alternative policy solution of a state-by-state mandate. Thank you.
The con has still 1 more minute if they'd like to add on to anything they said.
I can just very quickly reiterate because I saw some weird looks. But so essentially, instead of the federal government making COVID vaccines mandatory, they should use the legislative power they have to do what they've already done in some cases, such as removing the patent associated with these vaccines in order to help it and make it easier for states to adopt policies like this, to make it easier and free and more accessible for the people of these nations. Instead of the federal government mandating this vaccine, they should leave it to the states and focus their attention on making it an easier process, not only for the states, but for the entire globe to get access to these resources.
Thank you all for such an amazing debate. That was really fun to watch, and I think we all were able to learn something, and I hope that our opinions were maybe changed, or at least we thought about it. So I'd just like to remind the audience that if you have any questions for the debaters, to just post them in the audience Q&A. So now we're going to move on to the final segment of the event, where our guest judges will give their statements and their decision on who they believe won. So Ms. Saruwatari, would you like to go first?
Sure, thank you, Kevin. And is there a particular format, or should I just give my comments on the pros and the cons and then who I think won? Is that the way to do it?
Yeah, and if there's anything you'd like to add, feel free to.
Okay, perfect, great. Well, first let me start off with, I think that that was amazing. I would love to have all four of you come work with me in the health department. And as Kevin mentioned, I think, you know, you both presented arguments that helped all of us think differently and more broadly and learn. So I really appreciate the amount of time that you put into preparation. It definitely showed as you were going through your discussion. I think maybe what I'll do is just kind of go through, I wrote some notes as you all were talking. And some of these I intend to take back to my staff. So just so you know, I am getting a little benefit here professionally as well. On the pro side, I really like the discussion over herd immunity and the impact of herd immunity and whether or not we can reach herd immunity without having the politicization. I think throughout the pandemic, everybody has seen the politicization of COVID and early on the pitting of public health versus the economy. And so I appreciate drawing that out and also talking about how implementing a measure like mandatory vaccination can help get the economy back to a good place. So I think that was a really strong argument. I like the essential workers argument as well. I think that maybe a little bit stronger connection between essential workers and disease transmission. Disease transmission is really complex, right? So were essential workers exposed at work because they didn't have the equipment that they needed, or is it because maybe they live in multi-generational housing, or there are different factors that may come into play? So maybe just kind of addressing how that may impact the argument. I really enjoyed the graphic and the discussion about the unions and the minimum wage discussion. I think that was really interesting and helped to support the argument that you were making. And just overall, I think the point about leadership, the impact of leadership on the death rates that we saw from COVID, I think that also was really interesting and really kind of drove home the points that you were talking about. I think some of the questions as the debate went back and forth about the state and the federal government already having a system in place. So I think that now where we are through the vaccination campaign, and yes, we have some states like Vermont and Connecticut that have very high rates of vaccination, but if you compare population state to state, they have a very different population than a state like California. So when you get to a certain point in a vaccination campaign, people stop coming out to get vaccinated because everybody who wants it has gotten vaccinated. So how do you get to those other folks who don't want to get vaccinated? And I think that that's really kind of the crux of if you have a mandatory program, how do you carry it out? And so I think that that is important. And I think thinking about how you would do that and how you might pay for that is also kind of an interesting discussion. In terms of the con side, so I love how you started off with not challenging the fact that vaccines are safe and effective. I thought that was a great kickoff to the discussion. Interesting to me that, again, using the argument that 20 states have reached 50% either partially or fully vaccinated. And again, I would just point out the fact that states differ so much that reaching that threshold may mean something in a state like California and something totally different in a different state because of the demographic and economic profile of that state. I loved the back and forth about funded and unfunded mandates. I think that was also an interesting point and something that in government we deal with all the time, right? So there are lots of unfunded mandates that come down, and so I appreciate that discussion and tying it to the opportunity costs that you referred to. I think that was a good way to kind of drive home the point. I'm not sure that there's a direct connection to some of that, but I do like the thought process. I thought it was really an interesting point to raise. I appreciated the alternative options that you all presented. It showed me that you really thought that through, and the whole discussion about is it a state's right versus a federal right, also very interesting. I think the one point that the cons made that really I had to smile over was why differ from an established model that works, right? So state to state right now for vaccinations, we all have our own vaccination rules. And the measles outbreak, also really interesting banter back and forth. I think that in California, our rules have become more strict since that happened. So the exemptions are fewer, which helps with coverage and helps prevent those kind of breakthrough outbreaks. But again, really, I just loved kind of the breadth of picking different ideas to help support the points that you were making. One thing that I didn't hear from either side was a discussion about risk populations or children versus adults, and could there be a way to approach this looking at the different populations? So just a thought. I would love for you guys to work on this more, come up with more ideas, and let's do this again, because it was really enlightening for me. And then just a couple more things. I think for Brendan and Arleth, your point about preventing treatment and mutations so that you don't make the vaccine ineffective, I thought that was a really strong one. And I think that you could really perhaps have drawn a stronger conclusion between the impact on that when you have patchwork requirements across the state. And so you touched on that at the beginning of your presentation. I think you could have driven that home a little bit, but I think a great point overall. The one thing I think could be strengthened for Zeno and Zara was the comparison to the Patriot Act. While that is absolutely an unfunded mandate, I think choosing kind of a health-related unfunded mandate and how that is either successful or not would strengthen the argument more so than something like the Patriot Act, which was not directly related to health. So that's kind of my high-level overview of what I thought. Again, I can't say enough about how great you all four of you were. I really appreciated the dialogue. I really appreciated the banter back and forth. And I think, I read Kevin's email to me that says I can't think about this from my own personal opinion. So I think that if I had to pick a winner, I would have to go with Zeno and Zara, just from the perspective of, I think that the argument was presented in a more logical way, and the rebuttal and banter back and forth. But again, I think all four of you did a phenomenal job.
Thank you for your remarks, Ms. Saruwatari. I think we all definitely learned something from that. So Dr. Carpiano, would you like to give your concluding remarks?
Yes, and first off, well, one, thank you very much for having me, for inviting me to do this, and it's fantastic to be alongside Kim as well, to be as a panelist, and especially given everything that she's faced and encountered and done to keep us all safe in the county here too. So actually, I'm going to just give mine, because I'm a big cheerleader of her and her department's efforts too, and all this. So anyway, wonderful to be we're doing this alongside with her, and I want to compliment everyone involved here in terms of the debate. I mean, this was fantastic in terms of the depth, and well, I'm always proud of the students at UCR, but it's times like these when it's really it's evidence-based, as we say. So I have a number of comments, some of which I think might overlap a little bit with what Kim has raised already, but they're a little less organized along the lines of pro and con. I was sort of feverishly writing down notes throughout all of this and through the back and forth. And some things I want to bring up. First thing I do want to start off with is to say that I really like, in terms of how this was set up, that it's very important, I think, as sort of a foundational starting point, to say that it's good that we can emphasize that we can be evidence-based and be very pro-vaccination, and we can also be very pro-economy, at the same time, but realizing the fact of, well, recognizing those sort of issues, then what to do about it and how to go about doing it is really where, there's as both sides have kind of shown, there's the devil in the details. Mandates sound very straightforward, very easy, but as soon as you start to get into them, they get very ugly very, very quickly in terms of, the design, the implementation, the rollout, the externalities that can come from it, the opportunity costs as were raised as well. So I think it's a good standpoint to start from the perspective of ethics, that there is most certainly on utilitarian and more justice and deontological grounds to make the argument for vaccines and for mandates. But one thing that did come up, and I saw a little less of it with the discussion. I think Kim alluded to this as well. Is the issue around political will? We do live in a very diverse nation, and particularly if you just even want to look at states and territories. As the maps nicely showed up. And so, really implementing any sort of mandate is going to be, in general, is a very tricky thing, even at the state level, is what we've seen with vaccine mandates in California with SB 277 and 276 that were for school vaccinations. And so, you can now imagine that getting played out on a national scale is going to be very tricky. We can usually expect, as in terms of mandates, we can certainly expect some sort of pushback that's going to come from elected officials, given particularly the polarized times that we live in, but we could imagine them in sort of pre-pandemic sort of times as well. Sort of pushback from elected officials, special interest groups. People will sort of the culture wars. We can think about sort of media misinformation and disinformation that's out there in terms of, to get behind all these things, you really need to also have some sort of public support as well as decision maker support with these issues as well. And so those are really some very important, very critical variables. Even as we've seen most recently in Connecticut with some recent school vaccination mandates, even though they passed, it was still that kind of legislation becomes sort of an uphill battle in terms of the media around it, the protests outside the state capitol, and other sorts of information that gets circulating. So that can always be kind of tricky. Another issue would be thinking about the cost of enforcement. So that's always an issue with mandates. So we can think about again, so funded mandates, unfunded mandates, but even regardless of whether funded or not, just even thinking about the cost of what is it going to take to make sure that people stay compliant, and does that get passed down? Does that get handled by the state? Does it get handled by a county, by other local authorities? Is there a way to sort of standardize that across? And so that becomes another tricky dimension to mandates. And then with that, amidst a lot of talk about mandates lately in the news, a lot of talk around hesitancy. Hesitancy seems to be sort of like the big news buzzword. Everybody's kind of talking about it, but that tends to always get the issue around things about that. It's just simply people making decisions, and it's just about I'll get vaccinated or I won't get vaccinated, or maybe some shades of gray along with that. And what often gets overlooked with that, and a big challenge that the public health departments are facing nationally and certainly locally, is the issue around access. And how to get vaccines to people. So if you're going to be doing a mandate, you really do need to be making sure that you're meeting people kind of where they're at. And you can think about it as sort of a social contract. Government expecting people to go ahead and doing it, but at the same time expecting to make it easy. People expecting to make it easy for them to be compliant with that mandate too. And so, what exactly might that mean? Might we need to be putting more money into access? Might is the current situation good enough, and we just sort of then make it mandatory? So there's another sort of dimension that I think is very very important to consider, and of course the cost in terms of workforce, supplies, time, and all the other resources that go into that. The sixth issue is around mandates for whom. So we were talking here about sort of broad ones and to get everybody on board with that. But particularly now, as we're starting to talk, schools have been a very sort of politicized kind of area in school openings. And so, we can think about mandates. You can think of sort of like capital M mandates for everybody. And you could think about maybe lowercase m mandates for particular sort of subpopulations too. And so that becomes another issue maybe to be thinking about as well. Polls saying that certain parents don't want to get their kid vaccinated unless it's mandated. What that might mean, I think we're going to have to be waiting to see, how that might turn out. People vaccinating their child might be a very different thing than vaccinating themselves. They see themselves as sort of an adult, in a grown body versus a child, and so there's a lot of factors at play there as well. We can think about mandates for kids, of course, for entering school, but we can also think about them for college students, universities. You think about them as sort of collective living environments, communal living environments, and what exactly that might mean. Certain workspaces. And then also, of course, what level of exemption would we be talking about? So there's mandates, and there are, very strong, strict mandates, like California has for school enrollment in terms of medical exemptions only. But might we be doing, and what is the legality behind only having, of including religious and philosophical exemptions? Whether even not people might argue they're legit or not. That really there is a religious reason to not getting the COVID vaccine and vis-a-vis different organized religions. But putting that in, and so depending on how many different other opt-outs is going to be, there's going to be obviously it's going to be less effective than a medical only one. And then lastly, sort of an issue I think that both sides also need to kind of consider with this, and I guess this could be one for another debate, is really then the issue of how do we verify vaccines? The vaccine passport, whatever people want to call it, that's becoming a little bit of a sort of a politicized sort of word too. But vaccination records, where are we going with that, and how exactly might that be done? It could be something purely free market driven? Is it something maybe the government needs to be involved in, or maybe government private kind of partnerships in that regard too? Let me see here. Was that the last of my? I had to try to organize these as I was writing them all down feverishly, listening to all of you on this. And then so lastly too is just the idea of the externalities, and I think that's very important here. That mandates can create a certain sort of backlash effect in terms of behaviors too. And maybe in a way that gets me back to a bit of the first point of thinking about, the political climate and thinking about political will and elected officials who, want to keep their jobs. And so, to what degree they may have to respond to their constituents in red or blue or purple kinds of areas and thinking about that accordingly. And so, California and even Southern California is is very different than other regions of the country too, and how we have to think about that too. So all that being said, I'm worried I might have used up too much time here. I have to say, I want to congratulate both sides for. I hate the fact that I have to choose a winner here in this case, but in terms of sort of the issues covered and sort of the depth of in which they were able to go into it, my pick here is for Zeno and Zara for the comm position, and I'll have to say, I guess I can put in my little particulars on this too. I do believe that mandates work in many respects, and so, but the fact that I think there are a lot of thorny things here, and we have to sometimes be thinking about carrots first before sticks, as they say, and thinking about sort of incentives and using them as sort of mandates as sort of a last. Not a last resort necessarily, but at least carefully thinking them through without sort of that being sort of necessarily the first option. So thank you.
Thank you, Dr. Carpiano. I feel like I learned a lot in that in the last 15 minutes. So I do notice that we do have a couple of Q&A, a couple of audience Q&A questions. We only have 10 minutes left, so I'd like to read these. They are directed at the debaters, but judges, feel free to chime in if you think that there's anything to speak about. So the first question is for the con. When the con side mentioned that the one-size-fits-all mandate won't work, might this be because of how vast the US is, particularly the differences in urban versus rural and population sizes between states? That is, with the American population being more spread out, does it make it more difficult to mandate a vaccine versus a more compact European country, for example?
Okay, so to try to provide a little bit of information, obviously I'm not as knowledgeable as the two people that we were thankfully enough able to have judge for us. But so in regards to what would make it a difficult factor, yes, the size, the layout, the diversity of populations, the economic differences between cities, states, counties, these all are make the process of trying to use, at least in my perspective, a one-size-fits-all federal mandate. It makes it difficult because, as previously mentioned, it's like sometimes there's big differences between California reaching 50% of its population being vaccinated and a state like Rhode Island reaching 50% of its populations being vaccinated. So it could be difficult to try to set these universal goals to apply to all states that try to fit in the same way, when in reality our states are very much so different. And then breaking it down from states even further, there's huge differences and discrepancies between different cities, different counties, and different areas of that nature. But of course, I don't have any type of knowledge regarding to like the European Union or European nations, so I'm not going to touch that part of it, unfortunately.
Thank you for that, Zeno. We have one more audience Q&A. This one is more general, so anyone can chime in for this one. It's from Samantha. So in terms of making the COVID vaccine mandated, how would the government address people who do not trust the vaccine, as there's large mistrust in the government and medical field in America?
To answer Sam's question when it comes to the large mistrust in the government and medical field, I think it's first to regain that trust, to address that, hey, there is, some issues of racism when it comes to medical practices in the field. And to even have that conversation is going to be the first step. But in order to regain it, I think that goes back to policy to hopefully regain the medical, to just looking at, where does that stem from specifically in the field, if it's either, looking at it from, a systemic racist perspective or even medical health care. Maybe some people just don't have the means to be able to pay for certain things. And, of course, in like hospitals, you're not going to deny them the service, but some people don't even like to go. So I guess when going to the COVID vaccine mandate, I mean, it is free. And so that's going to be the first thing to look at, because it is free. Hopefully that will engage people to get the vaccination. But when it comes to the campaigning, how Ms. Kimberly was saying that, we just have to have that conversation, and that comes with regaining trust and when it comes to the medical field. So I think that's the first step.
Thank you, Arleth. So we have a couple minutes left, so I just want to make sure, does anyone else want to add anything before we conclude this event?
I would add to what Arleth said in terms of how do we get the message out and rebuild trust. And one of the strategies that we've employed as a health department is by recognizing and acknowledging up front that as government, we don't necessarily do that best. And so what we've done as part of the COVID response is we've contracted with community-based organizations and faith-based organizations. And we have given them funding and supplies and helped them with marketing. And those are people that are out in the community. And so then they go out and talk to their neighbors and to their friends. And some of them have formal community health worker networks or promotoras networks. And so by having somebody that's from the community, whether it's somebody who looks like them or goes to the same church or the same social circles, people tend to take information from them better than they do necessarily from the government. And so I think that as we approach these kinds of things, we have to think about not only what is the message, but how are we delivering the message and who is delivering it. I think those are just as important.
And we do have a follow-up question to this one related to that. How is the funding and supplies monitored to make sure it is used effectively by them? So I think this is referring to how the government can moderate how they would, how the mandate would work.
So for me, Kevin, is that the question is how do we do that? Yeah. So when we work with community-based organizations, we put together a scope of work that we both agree on, saying, you know, this is how we're going to evaluate success. Interestingly, and this is probably a topic for a whole nother debate, sometimes, you know, we also have to recognize that as government, we community-based organizations don't have the resources to be able to contract with government effectively, and so we have to be better at supporting smaller community-based organizations. But nonetheless, so we look at things like how many people were they able to do outreach to, how many people showed up at our vaccination site, how many people did they transport to a vaccination site. So we have very specific deliverables that we agree on together before we start the work, and then we evaluate based on if those are accomplished or not.
Thank you for answering all the questions. And I hope everyone was able to learn something today. I think that was an amazing debate. So I would like to congratulate Zara and Zeno for winning, but I think that the main purpose was that for us to learn and have a discussion about this. So I think everyone won in that way. So, and a special thanks to Ms. Saruwatari and Dr. Carpiano for taking the time out of their extremely busy schedules to be here with us today. We really appreciate it. And thank you to everyone who attended today's webinar. Our next online event will be this Friday, May 28th at 1 p.m. Pacific time, where journalist Tira Haley will speak about how to fight the global security threat of disinformation. You can learn more about UCR School of Public Policy events like this by visiting spp.ucr.edu. You can also learn about our new forthcoming BA/MPP program launching fall 2022 on our website. With that said, we hope to see you all at future events hosted by the UCR School of Public Policy. And until then, thank you and goodbye.